This is the Emergency Medical Minute, sponsored by Mile High Ambulance. The Emergency Medical Minute is excited to announce that we are now offering AMA PRA Category 1 credits. This is accessible through our online course modules that can be accessed at www.emergencymedicalminute.org/CME-courses, or simply by clicking on the link in our show notes and creating an account.
All right. Well, good morning, everybody. Quick medical minute about some of the stuff we do setting ventilators. We're lucky to have great respiratory therapists here. You know, we don't have to do a lot of ventilator management, but it's always good to know a little bit about kind of what we're doing and some of the important vent settings. So there's been kind of a gradual transition to what's called low tidal volume ventilation. 30 years ago, we used to set ventilators at like 10 milliliters per kilogram for tidal volume, how much breath goes in with each time the patient gets ventilated. And then they started noticing, or several studies showed that people did better with smaller tidal volumes. The big thing was that it prevented ARDS, or respiratory distress syndrome. Lower tidal volumes prevented that, and it's kind of been transitioned to low tidal volumes, kind of standard for everybody. The question that comes up is, does it really matter? Patients aren't down here for very long in the emergency department. Do we really need to stress about what we do here? Does it really make a difference? So there's a recent study that looked at low tidal volume ventilation being initiated in the emergency department. And one of the things that's actually interesting is that the vent settings that we pick actually do get carried on, sometimes for hours, sometimes even days once the patients get admitted. So what we initiate kind of matters for what gets continued once they get admitted to the ICU. And then the question is, does the low tidal volumes that we start here in the ED have a benefit to the patients? And this was a large systematic review that looked at lots of different studies of patients who were ventilated in the emergency department, started on low tidal volume ventilation, and it's pretty impressive. Overall, there was a decrease in occurrence of ARDS. So we do prevent ARDS by initiating low tidal volume ventilation here. There is a shorter ICU and hospital length of stays, decreased duration of mechanical ventilation, and decreased mortality. So all those things, which are very important outcomes, do matter and are better when we initiate low tidal volume ventilation. It's good to know, like I said, and sometimes if we have to be somewhere, the freestandings or somewhere where we are actually trying to start ventilator settings, definitely good to start with the lower tidal volumes, and that is usually 6 milliliters per kilogram of predicted body weight. So less is more when it comes to ventilation, and it does matter. Thanks, guys.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.